WERQ-FM, HD3 Baltimore, an Urban One radio station, minority controlled, and operated and serving the African American community for over 40 years.
The views and opinions of the guest and host you hear on 1010 WOLB
are not necessarily those of the staff and management of Radio 1, its sponsors, or advertisers.
All about healing. The Love Train of Healing on WOLB Baltimore is on the air. Reverend Bill Minson, your host. Welcome to our program this Do Something Different Monday. We are indebted in a way that we will never be able to repay the debt to doctors and nurses in hospitals, in ICU units throughout this nation, battling to save people's lives. Today, we're going to talk to a doctor from New York Presbyterian Brooklyn Methodist Hospital who continues to be on the front lines and has been on the front lines battling coronavirus since March. But first, always on All About Healing, we begin with Cheers for Heroes. Today, we begin by thanking and praying for the families of every doctor, nurse, healthcare professional, and worker. We thank you so much for your service. We're praying for you and your families, all our law enforcement, fire service, firefighters, EMTs, EMS, paramedics, 911 dispatchers, all our essential workers, and last but not least, the greatest armed services in the world, our United States Armed Forces and their families. Let's hear it for those keeping America afloat during coronavirus. Cheers for heroes. As we are watching infection rates rise throughout the nation, as we are watching deaths at an enormous number take place, today, despite the fact that we are under siege by coronavirus, we just had Hanukkah, we have Christmas coming, and Kwanzaa. So my guest today is a resident physician at New York Presbyterian Brooklyn Methodist Hospital, Dr. Rishi Talker. Dr. Talker, are you with me?
Yeah, I'm right here.
Welcome to All About Healing.
Thanks for having me, Rev.
Well, really, it's an honor to be able to thank you and your many colleagues, not only at New York Presbyterian, Brooklyn Methodist, but all your colleagues in healthcare throughout this nation that are doing everything you can to stabilize patients, to get them out of ICUs and back home. And I can only imagine the emotional toll that is taken on all of you. So we're very, very grateful for your service, and we're praying for you and your families.
I appreciate that, Reverend Bill. You know, those are some really kind words. I come from a healthcare family. My dad's a doctor. My mom was an ICU nurse. My brother actually also a member of the armed forces and oral surgeon. So this is a calling for all of us, and it's a very, humbling time in medicine, but at the same time, we feel very proud that, we go out there every day, we wake up every morning trying to care for, someone like they were my daughter, like they were my, brother, like they were my father.
Well, what a blessing to have that type of background and that type of support and that type of example. Your mother and father and your family are something that America is grateful for. Doctor, tell me what happened in March. Tell me when you first were introduced to what coronavirus was and how quickly it became a staggering reality to face.
Yeah, it was pretty startling, I would say. News told us, Trump told us, the media, everyone was said, this is not going to be that big of a deal. We'll be able to manage it. We'll be able to contain it. But the science was telling us something very different. The science was telling us that this was a very virulent disease that was causing a lot of people to end up on ventilators. There's a big mortality rate. I still remember the first case that we had at our hospital, and we almost didn't want to believe that it was a COVID case. This gentleman comes into the ED. One of my colleagues went down to visit him. He said, this guy is young. He doesn't really have any other health history. Why is he short of breath? Why is he needing extra oxygen? I think this is COVID. And even at that time, we didn't know what that meant. We didn't know what it meant with regards to the PPE that we would need or how to treat him properly, when we would have to intubate him. And all of this science that we've discovered over the last 9 months, that I think back on those initial times back in March where we didn't know any of that. We were intubating patients as soon as we could. And turns out later we found out that was killing them. We were, treating them by making sure they weren't getting enough fluids. We didn't want their lungs to get overloaded with fluid. That ended up being sort of inappropriate management because you don't want to dehydrate someone who's already sick. And we weren't giving enough steroids early on. Now that's our first line therapy, is giving a high dose steroid. So, what we didn't know back in March, the state of science has really progressed. And now we have remdesivir. Now we have, there's a new medication, baricitinib, that's a small molecule inhibitor we add on to the remdesivir in addition to the steroids, and we avoid intubation. So there's been a lot of progression over the last 9 to 10 months. But certainly when we initially were hit, the entire hospital was full. 400 out of 400 beds had COVID patients only. And people were dying 10, 12, 15, 100, day after day. It was rough. And we are, I think, in a much luckier place today.
Well, it sounds like what you're describing was a situation that nobody really could look at and have an answer. And apparently it was something you'd never seen before. And the only way out of this, the only way out of this was to experience and begin testing to see, what would help eventually. It's just, I remember I was in California and left to come to New York. And when I got to New York, everything shut down. And then what preceded was enormous death rates that I think eventually went up to 700 to 800 a day in New York, and just in New York. So when we look at numbers now of over 3,000 a day dying, 3,500 a day, this is a vicious, insidious virus. And we're trying to do everything we can to get people to cooperate, wear their masks, do what they can to protect themselves. Doctor, I need to take a quick commercial announcement. And when I come back, I want to talk about you and your colleagues and what it's been like to have to endure this and be stable in your life through all of this grief. We are with Dr. Rishi Talker, a resident physician from New York Presbyterian, Brooklyn Methodist, working with COVID patients on All About Healing, WOLB Baltimore. We'll be right back following this commercial announcement.
The next stop that we make will be fine. Tell all the folks in Russia and China too. Don't you know that it's time?
Be
mental healthy. You know, we spend a lot of time in the gyms building up our muscle. Well, not lately because we can't get in the gym because of coronavirus. But many of us are still shaken up, and the effects are felt in many different ways. Assess your mental health. Ask for help if you need it. We need you. Don't be afraid to reach out. Call the National Suicide Hotline, 800-273-8255.
Tell all the folks in Egypt, in Israel too. Please don't miss this train.
We're back on All About Healing, and today we're talking about physicians on the front lines battling COVID-19. My guest, Dr. Rishi Talker, is a resident physician at New York Presbyterian Brooklyn Methodist Hospital, where he's working with coronavirus patients day in and day out. Dr. Talker, one of the things that has been primary on my heart is the emotional strain on you and your colleagues, because COVID, of course, does not allow any contact with family once that patient is in the hospital. And most of you have to become that family at a certain time. And that, you know, being a chaplain is not an easy job from what I do and what you all are doing right now, in addition to the pressure of having to work on these lives and try to save them. To me is enormous, it's overwhelming, and I just continue to be in constant, ceaseless prayer for all of you. Can you tell us a little bit about that burden?
Absolutely. You know, I think that back before coronavirus, we would have patients end up in the hospital, and their, you know, daughter, their son, their grandson would be right at their bedside the entire time. Day and night, there was somebody there talking to them, feeding them, you know, advocating for them, letting us know what the patient couldn't tell us. And now we can't allow that, you know. Often the only person that patient is going to see that day is going to be the nurse that comes in to give them medication, and the doctor who sees them, a couple times of the day. And it's really, really important. I find it very important that we find a way to connect with our patients in a time like that. And I have a story of this one patient. He had come in, he was just looking down and depressed. And actually, a couple of the other doctors who had seen him said, we need to talk about goals of care. He's not going to make it. And I said, that's not really what's going on here. And so what I would do is I would go into his room. I gave him a ton of fluids to try to get his hydration status up, because when you're dehydrated, you're not drinking enough water, you're going to feel down in the dumps. And then I sat with him, and I literally just started to read the Bible with him. You know, I'm not even a particularly religious man myself, but I knew after talking to his wife that he had a strong faith in God, and I knew that if I sat with him and I read with him, that it might bring him and his spirits up higher. And it worked. You know, a couple days went by, and he really started to turn the corner, and the people that had kind of written him off, you know, they were happy to see him walk out of the hospital. And, it just goes to show that it really does rely on us at this time, because that face-to-face communication, there's no replacement for it. You know, we have these patients getting an iPad, you know, they're saying hi to their daughter, their wife, you know, they're saying hi through the iPad, but it doesn't have that same feel. When I hold them by the shoulders and I look them in the eye and I tell them that we're fighting this together, you know, that level of connection, I know, touches their heart and really motivates them to try to make that recovery.
You know, it's a very interesting thing to watch what this pandemic has placed a spotlight on. And one of the things for me has been the importance and the necessity of the human touch. You know, we have so many people throughout this nation that are homeless. We have so many people that are alone. And I don't think as a society, because we're all wrapped up in our activity, we have too many things to do, too many places to go, that we take time to realize the weight of loneliness on the human heart. And at this time, we're beginning to see what that is. You know, as you hear grandparents talk about not being able to see their children, their grandchildren, and vice versa. Old friends not being able to visit one another. We're beginning to see and appreciate the value of being able to touch one another. It's healing. And again, you know, I'm so overwhelmed by the work that you do, that you know about, that you signed on to do, and yet you're thrown in this position to be that proxy family member when no one else is there. So my next thought is, what type of provision is being made for all of you in terms of how you are able to go forward and show back up for work and do your job? I mean, is there some type of regular debriefing that you have? Do you have chaplains working with you, available to you? You know, we want to do whatever we can other than pray and encourage you to make sure that all of you come out of this whole and able to put yourselves together and go forward, because the potential for post-traumatic stress disorder is, to me, almost impossible to ignore for many in the medical healthcare field.
You know, I mean, Reverend Bill, like, you bring up such a profound point. We recently, I was on our respiratory care unit, which is kind of a step-down floor in between the general medical floor and the ICU level care. So these are pretty sick patients, and a good chunk of them had COVID. And I was talking to a couple of my colleagues, and I was remarking on a situation that I had where I really felt incredibly overwhelmed and underwater and to the point of really breaking down. And then after sharing that, I actually started to notice that the other residents had stories that they needed to share that told similar tales of, you know, feeling just overwhelmed and underwater and just completely inundated and flooded. And a lot of these emotions started to come up, but I could tell that they hadn't shared those stories before. They hadn't felt comfortable enough or to be vulnerable and to share exactly what they were going through. You know, we in medicine, in healthcare, we try to keep that stiff upper lip. You know, we try to hold our heads up high, hold our shoulders back. We try to hold our emotions at the gate. And that actually, I think, does more harm than good. So to your question of what can you do, you know, it is simple gestures. You know, we do hear thank you a lot. We have a lot of gratitude coming our way, and I always appreciate that. But, you know, I'll give you an example of something, somebody really kind, you know, touched me. My mom had sent me a package, and it got lost in the post office. So I gave a call over to the post office in Brooklyn, and a kind lady named Miss Thompson, she answered the phone and started this hunt for my package. And it was a 2-week ordeal, but she found it and sent it back to my place. And, you know, it was that just extra effort because she knew that I was a doctor, that I was taking care of these COVID patients, and that this just one little extra step that she took in my life was going to help me. And it's that kind of person-to-person touch, just helping your neighbor. It doesn't even have to be a doctor. Honestly, every single little bit of that compassion and gratitude you give to your neighbor, that gets carried forward. And you might have helped one person, that person's going to help somebody else, and the next is going to touch a doctor. So in that way, we can all be a little richer in the heart and in the soul.
Well, you know, I'm glad you mentioned Rosie Thompson because she's an outstanding chaplain in addition to being a member of the United States Postal Service. And I want to give her a shout out because I thank her for making you available to me today. That package was the reason that we got together. So
yeah,
I hate that you couldn't locate it, but it was good for me in the end. Doctor, I need to take one more quick commercial break, and then we're going to come back and continue talking about your work, the work of your colleagues. And believe me, today I'm so honored because for me, you represent all of the healthcare workers throughout this nation that I would love to hug and say thank you. So I appreciate you being with us here on All About Healing, WOLB Baltimore. We'll be right back following this commercial announcement.
That we make will be fine. Tell all the folks in Russia and China too. Don't you know that it's time to get on board and let this train keep on riding on through.
Community police partners. That's what we need. Not defund the police. We need the police. Community police partners. We have a unique opportunity to bring the community and the police together to solve problems in all communities. Let's work together. Let's let law enforcement know we have their backs as they protect and serve us all.
Please don't miss this train at the station. 'Cause if you miss it, I feel sorry for you. Sisters and brothers,
we're back on the Love Train of Healing, All About Healing, WOLB Baltimore, and today we're honored to be talking with one of the healthcare workers dedicated to keeping people alive through coronavirus pandemic. Dr. Rishi Talker, resident physician at New York Presbyterian Brooklyn Methodist Hospital, is our guest. Doctor, I want to ask you, you and your colleagues, it would seem to me, by the time you finish your shift, might be able to get home and get a little rest and come back. I'm wondering, have you been able to watch the progression of COVID through the nation? You know, as I said, when I came back to New York, the numbers started skyrocketing in New York. And then all of a sudden, New York started leveling off and the rest of the country started moving up. Are you in contact with other doctors throughout the country, assessing how this is going in various communities and assessing how your troops are holding up on the front lines?
Well, yeah, actually, I can speak to both sides of it. Working at the hospital, I really keep focused on what's right in front of me. You know, we see our patients, COVID or not, and people are in the hospital for all sorts of different reasons. But I'm also involved on a national level COVID task force with a lot of other resident physicians in other parts of the country, you know, over in California, New Mexico, Massachusetts. So I've been in contact with residents at other hospitals, and every one of us are going through our own little mini battle. You know, we have our little issues with, we're trying all sorts of different things, but really keeping those lines of communication open are key. And, you know, I'm the connector, right? But the people I work with 135 other internal medicine residents and, you know, 300 some odd residents in the hospital. So I try to connect them to resources at a higher level. And it's just trying to have that open communication. But, you know, to the gravity, the level at which the nation is suffering, you know, thankfully in New York, we kind of took to social distancing pretty well. And it looks as though, you know, other parts of the country are really dealing with the consequences of not social distancing. And it's not to say that that's the only reason that there are differences in the infectivity rate. There may be other differences in terms of strain, et cetera. But we know that wearing a mask works. We know that wearing even a cloth mask works. We know that distancing from each other, while painful, while we lose that human touch, does prevent the spread of infection. And so we have to weigh those risks and those benefits, the good and the bad. And we have to try to figure out, what we can do as a nation. But I will say, in New York at least, we've been fairly lucky so far. Our COVID rates in the hospital have been manageable. They've been something that we've been able to tolerate. We'd like it at zero. Right now, I think we have about 80 patients or so in my hospital. And thankfully, it's not in the hundreds like it was in March.
Well, thank God, because this is really, it's been something to watch and absorb the enormity of this pain at 100,000, at 200,000, at 300,000, 3,000 deaths a day, 3,500 deaths a day. In September will be my 20th anniversary serving the 9/11 community as a chaplain and spiritual care provider. We lost less than 3,000 people on 9/11. So to hear that we're losing American lives at 3,000, over 3,000 consecutive days, it's so painful to bear because each one of these lives is important to me. It's as though I'm connected to them like I'm connected to you right now. I think of the empty chairs at their homes, of the loved ones, their friends who will miss them this holiday. It's just a very painful thing to see. And we have a little bit further to go to get through it, but we're grateful for the vaccines. We're grateful for the medications that are making a difference now. We're at a different place.
There is an interesting number with the vaccines, and that number is 500,000. There were over 500,000 vaccines administered in just the last week to healthcare providers around the country. And I think that while we're waiting on supply, and that's one side of things, as we start to vaccinate and roll out this vaccine, we're going to have a lot more safety and stability in our communities. And that's something to look forward to.
I want to talk with you. I've got a station ID coming up. I want to talk with you about the mask, the available treatments, the vaccines. Going into the new year, it is certainly a new year of hope from where we were. But going in, like I said, even with coronavirus, we're calling bah humbug on coronavirus. We're still going to celebrate. We're still going to have Christmas. We're still going to have fun. Of course, I hope you'll do it with just you and a close friend. We want to follow the protocols to keep people alive. So we'll be right back on All About Healing. Let's have some Christmas from Donny Hathaway going into our station ID. We'll be right back on All About Healing.
Hang all the mistletoe, I'm gonna get to know you better this Christmas. And as we trim the tree, how much fun it's gonna be together this Christmas.
WOLB Baltimore and WERQ FM HD3 Baltimore, an Urban One radio station, minority controlled, and operated and serving the African American community for over 40 years.
The views and opinions of the guest and host you hear are not necessarily those of the staff and management of Radio 1, its sponsors, or advertisers.
Shake a hand now.
And we're back on All About Healing, WOLB Baltimore, and it is a very special Christmas. We've received the gift of vaccines to battle coronavirus. I thank God for answering my prayer, because I wasn't going to stop knocking on the door until I got an answer to help our doctors, our nurses, and our citizens. My guest today on All About Healing, talking about being on the front lines, battling coronavirus, Dr. Rishi Talker, resident physician at New York Presbyterian, Brooklyn Methodist Hospital in Park Slope, I believe. Is that right, Doctor?
Yeah, that's right. That's right.
One of the things that I want to get to right away is it's been very painful to watch nurses and doctors throughout the country in media beg people to wear their mask. And, you know, I think I mentioned to you, we've been doing a Facebook Live every morning at sunrise since, I believe, the beginning of April, have not missed one morning. And that, of course, is to salute all of you working, along with our first responders, all our essential workers, to thank you and to let you know we're praying for you and your families. But also, we have our signal. Wear your mask, guard a life. Social distance, guard a life. Wash your hands, guard a life. Clean your phones 3 times a day, guard a life. We need lifeguards in America to save your lives and to save your neighbors. And to see doctors and nurses pleading with the public to please wear a mask because of the difference that it can make. How does that make all of you feel to see people resistant to one of the few protocols that can make a difference here?
You know, it's really silly, to be honest. The fact of the matter is that people are dying, going to funerals. I mean, grandma's not sitting at the dinner table. Like, these are like human lives, but it doesn't register to, you know, that person who wants to go to an underground rave because they miss being around people, or, you know, they want to go to a bar because they miss having a drink around other people. I mean, we're fighting two very real issues here. One is, can we protect people's lives? And the other is, what do we do about our mental health? Because I think that part of the reason that people have such a difficulty following these simple guidelines of respecting each other by wearing a mask is because we have a mental health crisis in this country, and it's only made worse when we're separated from each other. I think the roots of this mental health crisis don't just stem from the fact that right now we're socially isolated and distanced. I think it has a lot to do with the way our system is set up, the way that we interact with each other, the way they have to work, you know, day in and day out and struggle to make ends meet. There's a lot of inequality in this country, and I think that you know, kind of isolates us and affects that mental health dynamic as well. But I do think that if you could just hear this as a plea, I have a feeling that most of the people listening to the show, you know, follow these rules. Please wear a mask, socially distance, wash your hands, bump elbows. We have to conform to this new social dynamic for just another year, all right? 6 months to a year, we roll out the vaccine. I mean, there's a lot of good and positivity to come on the other side of this, because all this pent-up energy that we have right now as a people, that's going to get unleashed in all sorts of positive ways. But we just have to do the right things now so that we can get back to a better state of life.
You want? We have a caller, Doctor.
Yeah, go ahead.
Yes, welcome to All About Healing.
Yes, how you doing?
Good, thank you.
Thank you for your show. Thank the doctor for coming on. I'll be real brief. I did want to plead with the doctor. Y'all saying plead with people about the mask. I would like to plead with the doctor to do some research on vitamin D and its effects on prevention of corona. And if you get it, it makes it a lot easier on you, because there's a lot of studies out there that nobody's paying any attention to. And I can see some of the information as well if you desire.
You are absolutely right, my friend, 100%. You know, you're not going to get any argument from me. In fact, back in March, when all these patients were coming in and we didn't have any treatment, we were giving them vitamin D. We gave them zinc, vitamin D, vitamin C, and, you know, hydration, you know. I mean, part of the problem is that you don't feel like drinking water, you don't feel like eating food, you don't have your sense of smell. And those are all the things that will make you sicker, not eating, not drinking, not having the right vitamins. So I do 100% agree with that.
Yeah, vitamins in general are good for you, but what I'm saying is that the studies actually concentrate on vitamin D itself. And they did an actual study where they did 700 Indonesian patients that died from COVID-19. Out of that 700 patients, 96% of them were vitamin D deficient. So they've been figuring out correlations between that, and they've been finding out that the lack of sunlight in a lot of countries, and I'm thinking it's related. It could be related to the winter time, the surge in the winter. As you know, they're saying it's Thanksgiving and Christmas and all that, but
that's absolutely right. That's absolutely right.
Well, there's no question. I had been reading about and been advised on the vitamin D deficiency showing up in so many of the COVID deaths. So it's great that you called at this moment to bring that point up so that people can be aware and take action.
Let me warn you, though, vitamin D, it can be toxic if you take too much of it. So you should find out what your vitamin D is.
You should find out what your levels are and then have them followed up. There is absolutely a correlation between low vitamin D levels and reduced immune response. It's also worth noting to our listeners out there, vitamin D is made by converting sunlight, and as it passes through your skin, it'll convert vitamin D to the active form. So the darker your skin, the more sunlight you need, and then when you live in a winter environment where you don't get a lot of sunlight, that's when you need to start to check your vitamin D levels and get them repleted.
You're spot on, because and that's, they did a study where they took 152 countries, and they found that the countries with the less sunlight had the most COVID deaths. So it's important that you get your sunlight, because you're right. You need the ultraviolet, the UV radiation from the sun to process vitamin D, which is processing your skin. And 80% of black people are vitamin D deficient, by the way. That's why.
Thank you so much for your valuable call today, and you stay safe. God bless you and your family.
God bless.
Be well.
Doctor, let's talk about the vaccines that have arrived, because one of the things that I'm looking at with the blessing of the vaccine is that I don't want it to become a curse. In other words, people saying, well, now that I have the vaccine, I can be a little careless. I don't have to follow the protocols. And, of course, you just said, listen, we've just gone through, 9 months of the most difficult time I've seen in my lifetime. If we just follow the protocols for one more year, it's likely we can get back to pretty much the life that we knew. But the problem is we have a nation of people that want to do what they want right now. And everybody needs to understand we need to do what we need to do for every American life. It's a different page for Americans to be on, Doctor. It's a different page for Americans to be on, because we have it that good. We've been spoiled.
Absolutely.
In this great nation where you see so much that you really don't have to contribute to. So I just do what I want to do. And right now, that's costing lives.
I think it just is this great American story that we've been told and been telling ourselves since we were kids, right? Children go to school and they learn about the American Revolution, and they learn that Americans, had an independent spirit and they fought against the tyrannical government, right? And we then have this Bill of Rights that protects us from the tyrannical government. And that, I think, is the basis, the rationale for why we say, forget the government. I'm not going to listen to what they have to say. I'm not going to listen to what anybody has to say. That's my right as an American. And it's really silly. I mean, it's really, really shameful, actually, we can't create a society where everybody just wants to do their own thing. That's not the way that we can really build together. All right? Now, in terms of the vaccine, I will say that, what we are seeking with any vaccine is herd immunity, right? So there's a reason that I don't need to vaccinate everybody against smallpox anymore, right? We figured out a way to isolate smallpox to basically the laboratory. all right? Or the polio vaccine. Polio vaccine, every kid gets it in one form or the other as a child, and now the only places you find it are some parts of India, Bangladesh, and Pakistan, where they haven't gotten the vaccine yet. All right? We've been able to vaccinate against these diseases and really hold them back. Human ingenuity beats Mother Nature, and we have a track record of it. The only thing that we're missing here right now is the interim, where we really are trying to keep people safe. And I think that the results, what we're really seeking is a return to that stability, that sanctity that we once had. I think the vaccine is going to offer that quite a bit. It's quite interesting. Getting into the vaccine a little bit, there's something new and interesting about this vaccine that I think might cause a lot of reservation just because it's novel. It's called an RNA vaccine. So most vaccines, like the ones I described, if you get your pertussis vaccine, if you get your tetanus vaccine, what they do is kind of introduce a little bit of the protein particle, and then they do that over a series of injections. And as the protein particle gets introduced to you, your body takes it up, chops it up, finds a way to make antibodies to it, and then distributes those antibodies in the body. And then, like the tetanus vaccine, you got to get a booster. All right? I think that we're probably going to see that we need to get COVID vaccine boosters over a longer period of time. But the way the COVID vaccine works is different, is novel, in that it uses RNA instead of protein.
I see.
If you want to know a little bit more about how that works, I'd be happy to explain. But basically, you have DNA, which is your, genetic material, and you have protein, which makes up all of you. All of your cells and all of its functions are made up of protein. And so the chain between DNA and protein is linked by RNA. And so what they've done is inject this RNA directly into the people, myself included. That RNA gets taken up by the cells. It gets converted to the protein, the spike protein that the virus uses to get into cells. And your body makes the spike protein without the virus. There's no virus associated with it. It's just the protein. That protein gets taken up, chopped up, turned into antibodies, and now you have antibodies against the spike protein of coronavirus. And that even, so far as we know, protects against different strains of coronavirus.
Have you received the vaccine?
So, yeah, actually, my hospital rolled out the vaccination protocol. And, the vaccine is a two-part vaccine. There's actually 4 vaccines out on the market right now, but only 2 have been approved in the United States. That's the Moderna vaccine and the Pfizer vaccine, both of which are RNA vaccines. There's a vaccine out in Russia that they developed really early on. They said it works like 92% of the time. I don't think that they're telling the truth. And then there's this Oxford vaccine that was rolled out in the UK, but they use a viral vector instead of RNA, kind of like they're using the protein instead of the RNA, and theirs aren't as effective. It's some like 62 to 85% effective versus the Moderna and the Pfizer vaccines, which seem to be about 95% effective. And those were tested across 40,000 different people. In each separate trial, they had 40,000 people in each arm. Really kind of incredible numbers, but kind of goes to show how effective this vaccine it really is.
I need to take a quick commercial break, Doctor, and we're here on All About Healing with Dr. Rishi Talker, a resident from New York Presbyterian Brooklyn Methodist Hospital, working with coronavirus. And we'll be right back.
Everybody, start a love tree. All around now, join in, love ride, love tree. The next stop that we make will be.
Evading coronavirus is serious business. We need you to be a lifeguard. Sign up today. Guard a life. Wear your mask. Guard a life. Wash your hands. Guard a life. Social distance. We need lifeguards to protect our people from coronavirus. A message brought to you by Today Ministries, praying for you and your families to be safe. God bless you.
And we're back. We're back on All About Healing. WOLB Baltimore, the love train of healing, rolling through coronavirus into a new year of hope. Today, my guest is Dr. Rishi Talker, a resident physician at New York Presbyterian Brooklyn Methodist Hospital. Doctor, you have received the vaccine. Can you tell me if there was a noticeable difference in attitude at the hospital among your colleagues when they were able to receive the vaccine?
You know, I feel that the vaccine definitely brings a culmination to this year of suffering and grief for us, at least a little bit. I will say that probably 80 to 90% of us actually got COVID back in March. All right, we while we were taking care of these patients, before the CDC's initial guidelines actually didn't always involve N95 masks. They didn't know what an aerosolizing procedure was, etc. So at that time, we were just going into these rooms, taking care of these patients, and we had our attendings who were much older. So, like 60s, 70s, 80s, like we didn't want them going in and kind of getting these viruses. Anyways, because we all had it, it definitely has softened the blow for us because so many of us had it. We felt a lot safer about, us not getting it in the future. And now our entire hospital, there's not been one single case of reinfection among the residents at the very least. Now, after we got the vaccine, I mean, it's just definitely you could feel kind of this breath of fresh air that at the very least, whether I had it or not, whether I was super sick or just mildly sick, at least my body is going to start making antibodies to this virus and, prevent me from really being at risk of getting super, super sick in case I do get re-exposed or get infected with a new strain or something else like that. So I do think there's a peace of mind that comes to us now.
So the vaccine develops antibodies.
That's right.
Okay. Now, have you taken a look at the new strain that the United Kingdom has announced?
Yeah, absolutely. So I was reading about that earlier today. It's actually really startling. There's like 50,000 new cases in London in just the last week. And then they find this strain actually, I think Italy, Belgium, Denmark, Netherlands, and Australia have seen this strain pop up. Now, the interesting thing about this strain, I need to make a clarification, all right? It is more transmissible. That is true. All right, but transmissibility is not the same as danger. I got to be very clear on this, okay? Just because it can transmit more does not mean that it's more virulent or that it actually causes extreme symptoms and worsening disease. In fact, most viruses that become more transmissible actually are less dangerous. All right, the average coronavirus vaccine, the average coronavirus in the community, there's many of them, there's probably hundreds of them, and it's just your average head cold. It spreads from person to person, doesn't really cause a lot of symptoms, and that's really good for a virus's life cycle, right? A virus is trying to replicate, is trying to move on to the next host, is trying to spread itself. Now, if it kills the host too soon, it's not going to spread that much, and that's bad for the virus's life cycle. So what this virus is doing is it's mutated, and we know viruses mutate, but it hasn't mutated in a way that renders the vaccine obsolete, at least not in any major way, because it's some minor changes to the spike protein, but not major enough to render the vaccine obsolete. So the vaccine's still going to work, and ideally, this particular strain is actually going to be less virulent, which might correlate with the fact that it's actually more transmissible. So these are the kind of the tiny little differences here that I'm kind of alluding to. But really, if you look at it from the virus's perspective, its goal is to become less virulent over time. And the more virulent strains will find its way into the hospital and out of the community. You hear? Like, the sicker you are, the less likely you are to be spreading it. So then you end up with more asymptomatic infections, and eventually you just end up with the kind of, like, nothing worse than the common flu, which is not to say that there's nothing wrong with the flu, but it's a lot more manageable than full COVID pneumonia.
I see. The other thing I want to ask you, as I am a fan of healthcare and law enforcement and all our first responders, what is it, in your opinion, that's going to be required for our schools to open safely, for our teachers, administrators not to be at risk, and mostly our children not to be at risk? I
mean, the only thing that I see moving us in that direction is widespread distribution of this vaccine. Because without the vaccine and without being able to count on antibodies, we aren't really able to determine if we have herd immunity. And remember, this is basically the best example we got of we're all in it together. You know what I mean? We are all in this planet together. We are all in this earth, in this country. We're in these communities. We are in this together. But you don't see it until you think about this concept of herd immunity. Because black, white, purple, it doesn't matter your skin color, doesn't matter what your religion is, doesn't matter what separates you at all. We all have that same red blood in our veins. And we all need those antibodies in order to protect each other. And so that's what I think gets us and our first responders and our teachers, and our children, who really, I think, are struggling to develop the right social skills outside of person-to-person interaction. This is how we get them back to that sense of, normalcy, is let's get everybody these antibodies to get that herd immunity and, get in this together.
Well, media, in a way, helped us get here. The confusion, the division, media can help us get out of it. It's a question of whether or not we will join together for the sake of the United States of America and the people of the United States of America, rather than any other agenda, and make it one message so that people have the confidence, they can buy in, and they can understand someone else's life depends on what each of us do now. And it's going to be that way. So I'm hopeful that at some point, as we come into the new year, that our behavior will shift and change from being selfish to selfless. Because, every morning when I'm going out and praying, and I'm thinking of you, I'm thinking of the people working beside you, I'm thinking of the police officers going in the homes, not knowing what situation might be. When I'm in Las Vegas riding with Las Vegas Fire and Rescue, going in the homes, we don't know what's there. So everybody's at risk. And if everybody would just pitch in, as you said, and become part of the solution, how much better we would be. Excuse me. I'm so happy to actually have you on the show today, because I'll be able to sleep with more peace tonight, because when I get up and go out to look for the sun in the morning, I will have talked to a doctor and said, I'm coming to your hospital to hug every one of you as soon as I can.
Wow. Reverend Bill, I really am so grateful to have been here talking to you, talking to the community. I do think that we need to come together and look forward to the future. It might not be tomorrow, it might not be next week, but there is a horizon right in front of us. And we have all this pent-up energy as a community that is ready to be unleashed. Think about the businesses that we can start and the children that we can teach and the communities that we can uplift when we get to touching each other again and being around each other again. And thank you for giving me the opportunity to reach out to your listeners, teach them and tell them a little bit about the vaccine, how safe it is, what we're doing. Even if you do get coronavirus, we have treatments now in the hospital, and our death and mortality rates are, really approaching kind of like single digits or lower. We're really looking forward to any opportunity if you need another chance to talk, or, your listeners have any other questions, I'm happy to be on.
Well, I appreciate it very much. Is there anything you would like to say to our audience about travel and contact about this Christmas holiday and coming New Year?
So, absolutely. I would say as important as it is to see family, you have to this Christmas time, just for your family, try not to see each other. I as hard as that may be, it may be for the best, because a year from now, you'll get that opportunity. Maybe even 6 months from now, you might get that opportunity after we've rolled out all the other vaccinations. But, what we don't want to see, especially, I'm telling you, as a doctor working in the hospital in Brooklyn, where, listen, we have 400 beds, and at one point, every single one was full with COVID. And what we can't do now is have that happen again, because all the people with GI bleeds, with heart attacks, with, the cancer, all these other diseases that also need those beds, they won't have anywhere to go. We won't have a way to handle everybody. So for my sake, for my colleagues' sake, for any healthcare professional you've ever met, and for Grandma and Grandpa's sake, I say stay at home, avoid the travel, Zoom each other, count your blessings, and meet each other in a few months.
Doctor, thank you so much for joining us on All About Healing. I am deeply indebted to your mom and dad. Tell them I'll be looking to hug them as soon as I can, because, boy, they gave us something special at this time in America where we need people that are willing to step forward and do everything they can for America. Thank you for all your information. Thank you for your service, and we'll look forward to seeing you again on All About Healing. Today, we're going to go out with Donnie Hathaway and more about this Christmas and a coming new year that's going to be better for every American that's able to hold on. Do your best to support your community. Do your best to support your neighbors, and we'll make it through. One nation under God. See you next week on All About Healing, WOLB Baltimore. God bless you and your family. Stay safe. Come on, Donnie.
We're caroling through the night, and this Christmas will be a very special Christmas for me. Merry Christmas. Shake a hand now. Wish your brother Merry Christmas. All over the land now.